There's one thing that seems to fascinate and frustrate every single American. It is weight control. We are constantly bombarded with ads for diet pills, fad diets, and weight control devices, and a lot of them don't seem to work. But health editor Dr. Winnie King has found a surgery she claims actually does the trick.
It certainly does, but some people may consider it to be a bit drastic. It's not for everyone, but when a person is severely overweight, meaning at least 100 pounds overweight, there is a surgical alternative that works. You've seen her on the popular sitcom Family Matters, but Jo Marie Noble wasn't always so slim and shapely. Going from one diet to another, she struggled with her weight for years, at one point tipping the scales at 283 pounds.
I wanted to die because I was 283. I was 17 pounds from being 300 pounds.
At her doctor's suggestion, she had surgery for stomach stapling. Although her weight dropped as low as 128 pounds, the procedure left her with problems keeping food down. So last year, she had a relatively new form of the surgery called the Fobi-Pouch procedure.
I don't have to throw up anymore. I feel great, you know. I'd do it again tomorrow if I had to do it.
Dr. Mal Fobi is an expert in weight loss surgery. Over the years, his surgical techniques have resulted in dramatic weight loss for his patients. This mother and daughter lost hundreds of pounds from the surgery. Jesus Laredo lost nearly 300 pounds and went from taking 14 medications a day to taking only 2.
It's a surgery that reduces the size of your stomach. So when you eat 2 tablespoonfuls of food, you feel full. And you have to wait for that food to empty before you can take some more. This delay process causes you to eat less food, and therefore you lose weight.
Practically all of the surgery patients cite significant health benefits, but even more important to them is the opportunity to enjoy a happy and active life.
I'm glad I feel good now. I'm glad I look better. I'm nobody's beauty queen, but I feel like the ultimate queen inside.
Now, if you'd like more information about this surgery, you can call the Center for Surgical Treatment of Obesity at area code 310-412-7169. Now, bear in mind, this surgery does cause patients to have deficiencies in vitamin B12, thiamine, and vitamins A, D, and E. So taking vitamin supplements is a must. By the way, the cost for the surgery is $6,500, and with hospital fees, it runs about $23,000. Oh. But fortunately, most insurance companies will pay for this surgery. They'd rather pay for this than to pay for the heart disease, diabetes, and arthritis that will ensue if you don't get this problem corrected. This is fascinating. You know, a lot of his patients, he said, came to him diabetic. After the surgery and the weight loss, they were completely cured and no longer needed insulin.
Oh, that's wonderful.
Yes.
That's wonderful. Thank you, Dr. King.